And I'm going to combine, I'll take my time now. Dr. Bhattacharya, I'm going to combine the conversation with Murkowski and Blunt Rochester. There are sections of our country that look like Denmark, in which are highly educated folks who have easy access to vaccination. But the diversity that Murkowski was speaking about, which you agreed with, there are areas in our country where that is not the case. And those that put together vaccine schedules in the United States take into account the behaviors of different types of patients. Again, if you're wealthy from Boston, you're going to have one experience. And if you're less wealthy, if you're poor from a rural town in Louisiana, you're going to have another. Now, if we pattern after the place that is wealthy, we're not meeting the needs of those who are poor. And so I have to admit, I was a little bit kind of like, what? We're like Denmark? I was just kind of like, that's a crazy idea.
I mean, so Senator, I guess the way I'm thinking about it is a place like Louisiana and others where there's more distrust of the public health.
Can I stop you for a second? You had mentioned, and I thought this was very positive, that you have found that the stereotype of the secretary being unopen to new ideas. Have you discussed vaccines and autism with him?
Yes.
And did he change his ideas?
I mean, you'll have to ask him, Senator, but...
I've discussed, and he's not. And I say that because at some point, I'll agree with Blunt Rochester on this. At some point, there's a wonderful scripture about how the clear note sounds. If the clear note is, yes, you can trust. And to credit to the secretary, after 2 kids died in West Texas from measles, a vaccine-preventable disease, the clear note finally went out. You should get vaccinated. My fear is that we're going to have meningococcemia with children losing fingers and legs and noses because now we don't vaccinate routinely for meningococcemia. Rare but highly consequential. This is dangerous. And I'm afraid that that cacophony of notes is going to further undermine trust. Do you not see that?
Yeah, I guess I think of it differently. I think we have to reestablish trust. Absolutely. I share your goal entirely. And the question is the method of reestablishing trust. I think that if you just double down on what we've previously done that led to the loss of trust, we're not going to change it.
Well, we were both professors. I don't mean to interrupt, but we're both professors. And we know that it may seem lofty, but education is the way that you address trust. Now we have a measles outbreak among those who did not trust. Now, is it to further cast doubt upon the measles vaccine that say that the MMR should be divided into 3 doses for no scientific reasons, to increase the number of shots that a child has to take? No, that's not going to increase trust, and it's going to decrease complete immunization rates. We know that from experience. I'm just curious about that.
So I'm not certain that that's true, Senator, that we will not. I mean, I think that the key thing about the Danish experience is that establishment of public trust. By being open.
That's because the Denmarks it's a club. It's not a country, it's a club. If you go to Denmark, it's like going to your Kiwanis club. Everybody knows each other, they all look alike. And that ain't our country, you know what I'm saying?
I mean, I don't know. I know several Danish people, and they're very different from each other. But I don't want to stereotype. I think the key thing is, how do we reestablish trust?
And I think that's a clear note. If you keep on telling people permutations of what is false, they don't know who to believe. Let me just move on to something else, and I may have a second round since I'm here to the very end. I want to quickly develop, and you and I spoke to this on the phone. There are researchers in every state in this nation that if they had access to that wonderful equipment and those resources at NIH, they could achieve their goal of helping our country get healthy. Please elaborate on your ideas and the things we discussed of how that can become a possibility.
Absolutely. So the NIH is divided into 2 parts, the intramural program and an extramural program. The intramural program is what happens, for instance, in Bethesda, in Montana, a whole bunch of other places where NIH employees, scientists themselves do research. Extramural is all the scientists that we support all across the country in universities and elsewhere. I want to, just as you do, I think, I know that I want to make sure that we have collaboration, that the intramural program serves as a resource for scientists all across the country. We have some great examples of that. The National Institute of Aging, the Center for Alzheimer's Research, where extramural scientists can use resources at the NIH that they wouldn't otherwise have access to, especially in places universities that don't have those facilities. There's the NCAT's repurposed drugs program where they can participate. I think that's such a great idea, Senator, and I would love to work with you on making that more extensive across the NIH.
Okay, I appreciate that. Now,